Hello, everyone. A very warm welcome to you all. My name is Katrina Devereux, and I'm joining you from a city called Cork in Ireland. I am a TV producer, documentary maker, and science communicator, and I have been making and presenting factual programming about science, health, and the environment for almost 20 years. In my personal life, I am a mother to a 7-year-old and a 4-year-old. And like many first-time mothers, I found breastfeeding challenging, and I needed lots of support to help me in my breastfeeding journey. With the desire to pay some of that support back later, I trained as a volunteer breastfeeding counsellor with a parent support organisation in Ireland called Publikują. And through that work, I realised that even though one-to-one support is very important, it can't help all the other factors that influence families' infant feeding choices. So today, part of my personal and professional life are intersecting, and I'm thrilled to be moderating this launch, the first of 2 events today, launching a new WHO and UNICEF report on how the marketing of formula milk influences our decisions on infant feeding. This event is co-hosted by WHO and UNICEF, together with 3 other partners, Save the Children, FHI Solutions, and the Partnership for Maternal, Newborn and Child Health. This report is the culmination of years of research involving thousands of participants across Mexico, Bangladesh, the United Kingdom, Vietnam, South Africa, Nigeria, China, and Morocco. But today is really just the beginning. This report provides strong evidence for the pervasive and exploitative nature of infant formula marketing, and is a call to action for all of us to do more to protect children adequately. This is not about infant formula as a product or criticising families who can't or choose not to breastfeed. It is about protecting all families and their healthcare providers from marketing that is driven by the pursuit of profit, not the pursuit of public health. We have participants from governments, civil society, the health workforce, the private sector, and community representatives joining us today from all over the world in different time zones. So good morning, good afternoon, and good evening to you. It is great to see the geographic spread and interest in this issue. We want to start a worldwide conversation about this issue, so feel free to share your thoughts and spread the word on Twitter, Facebook, or Instagram using the hashtag #EndExploitative This whole event will take place in English, but there is simultaneous interpretation available in French, Russian, Spanish, Arabic, and Chinese. To access language interpretation, click the language just below the live feed. The event will be recorded in all languages and available on this website by tomorrow. We have a full agenda today to learn about this important report and to hear reactions from our distinguished panel. So without further delay, let us kick off. We begin with a message from a man who needs little introduction. He has been immensely supportive of this work, and we are so pleased that he has agreed to open for us. Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus.
Dear colleagues and friends, what children consume during their first years of life can profoundly affect their development and future health. That's why parents and caregivers need access to evidence-based scientific information and support, free of commercial interests. This new report from WHO and UNICEF exposes the marketing tactics used by the commercial milk formula industry, which has led to the overconsumption of the formula milk and undermined breastfeeding. The report shows how companies try to influence pregnant women, mothers and other caregivers, as well as health workers through advertising, gifts and financial incentives and misleading scientific claims. There is more at stake than market share. Consumption of milk formula can adversely affect children's health, growth and development. In high and low-income countries alike, the use of formula instead of breastfeeding increases risks of mortality, diarrheal and respiratory diseases, childhood obesity, diabetes, and maternal breast cancer. While there are reasons parents choose to use formula, there is no excuse for marketing practices that push formula when it's not needed. WHO is working with partners and supporting countries to implement the International Code of Marketing of Breast Milk Substitutes. Together, let's stop the commercialization of our children's health. I thank you.
Thank you, Dr. Tedros, for that powerful message. Now, as you will hear later, one of the unique features of this report is it includes something that is far too often overlooked: the experiences and voices of pregnant women and mothers, over 8,500 of them from 8 countries. Women's voices are absolutely central to this discussion on marketing and infant feeding. We can't escape the fact that women are the primary targets of formula milk marketing, and the industry goes to great lengths to reach women and influence their decisions at such an intimate and often vulnerable time in our lives. The following video brings together the voices of some of the thousands of women interviewed for this research. Their words are read by actors. These words will help to set the scene for the rest of the event.
After I gave birth, they seemed to be fighting for the first sip of formula milk. Obviously, we were looking online and that little advert for the same brand of milk just popped up. And with these cookies, I mean, they must know that we're looking at baby stuff.
I saw an advertisement on Facebook. The ad was eye-catching. Register immediately to receive 110,000 Vietnamese dong discount code.
I think that all those scientific acronyms like DHA give a feeling of scientific sophistication. You don't know what it is, but sounds cool.
I find those advertisements more reliable when there is someone with a white lab coat.
Yes, when mothers see the ad, they get motivated as they claim brain development, nutrition, and other benefits. Then the mothers think that if they feed this to their baby, then their baby will be healthy.
In the hospital, they say, when she is born, buy this formula.
I have been given a free sample at the hospital. I think that's a form of advertising.
I feel like part of the advertising is done by pediatricians because my pediatrician told me give him this milk and he gave me a free sample.
Stage 2 and Stage 3. It's kind of like, let's continue your journey. Let's help you. I felt like I was tricked into the full-on formula.
It's comparing it to breast milk. It's justifying giving formula because it's talking about how similar it is to breast milk.
I know formula milk is supplemented with various vitamins and nutrients and things. And it just made me a bit worried that maybe I wasn't giving him enough.
I do like the look of the one formula brand where it's scientific. It will make me feel like more research had been done into the ingredients that might be better for my baby. You know, we all want the best for our children.
Those are words from women from around the world, but now it's time to drill into the report in a bit more detail. Remember, the full report is available to read on WHO and UNICEF websites. And to give us an insight into the findings, I'm pleased to introduce Dr. Nigel Rowlands from WHO in Geneva and Anuradha Narayan from UNICEF in Beijing, who will walk us through the key findings from the report and what they mean for us going forward. Nigel, over to you.
Thank you indeed there, Katie. And it's great to have everybody with us today. Before really going into the findings of the report, I think it's important just to set a little bit of the background. Infant feeding matters. How children are fed in the first 6, 12, 24 months of life has a remarkable impact on human biology. It thereafter has an effect on lifelong health and development. And it also really impacts on maternal health. As Dr. Tedros was saying, it reduces the impact of breast cancer and ovarian cancer. And strikingly, up to 800,000 children's lives would be saved each year if feeding practices were according to the WHO recommendations, which is exclusive breastfeeding, continued breastfeeding for 24 months or longer. But there are many reasons why women are not able to or prefer not to breastfeed. And we can see the patterns how over the past 20 years, the changes in breastfeeding practices have been less than what we would have hoped for. Work constraints, inadequate maternity protection, a sense of that a mother doesn't have enough milk, some of the societal norms and the healthcare support all impact on that decision as to whether a woman chooses to breastfeed or not. However, the commercial marketing of formula products unquestionably has an impact, and that's really the focus of this research and the report. The World Health Assembly in 1981 adopted what was called the International Code of Marketing, and this followed practices observed over the preceding 30 or 40 years. But indeed, ever since the first formula milk was patented, there have been examples of how marketing of products has been repeatedly pressed forward. And in the 1970s, there was the famous baby killer report, after which the World Health Assembly and many of the countries collectively agreed that something needed to happen and together made recommendations that formula milk marketing shouldn't happen at all. One of the problems, however, is that our understanding of marketing is probably very fragmented. We know about occasions whenever adverts are put up, whenever we see posters or free gifts, but marketing occurs in multiple environments. Influence of policy and investments, influencing international regulatory standards and bodies, in the labour market. But the report and the research focused really on information and attitudes. In what way is marketing trying to influence both at the individual, the health professional, and community level, the attitudes of all of us, and what is the impact on that on practices? I'll pass over now to Anna just for one. What we do know about marketing, however, is that in 2019, annual sales were $55 billion, which is a large amount of money. And we know that between 5 and 10% of annual sales are invested in marketing. So that stacks up to between $3 and $5 billion every year that is being spent just on marketing. To benchmark that, the WHO operating budgets for 2 years is $5.8 billion. So industry is investing more in marketing each year than WHO has available for its full practices. And over now to Anu properly.
Thank you, Nigel. Before Nigel shares the report findings, I think it's worth taking a moment to mention the critical importance of issue framing. Let's be clear from the beginning. This report is about marketing and it's not about the product. This report is about the basic right of parents, mothers, and caregivers to access and receive accurate and impartial information when it comes to feeding their children. These rights are clearly outlined and protected under the Convention of the Rights of the Child. And this report is about public health interests against commercial interests that seek to maximize profit at all costs. Now, we know that industry might reframe this debate to suit their purpose as they have done in the past. They will perhaps seek to suggest that UNICEF, WHO, and other partners are pitting breastfeeding mothers against formula feeding mothers. This is not the case. They may seek to reframe this report as an attempt to limit women's access to formula milk. This is also not the case. And they may seek to juxtapose women's rights against children's rights as if this is a zero-sum game. This is also not the case. With this framing in mind, I'd like to hand it back to you, Nigel, to share the main findings from the report.
Thanks, Sarah Anna. So this research and the report was conducted, as Katrina said earlier, in 8 countries. Before starting, I want to acknowledge the many people who contributed to this. First and foremost, the women and health professionals who contributed their time and experiences to the research. the research unit and the team that designed and implemented the study in the 8 countries who analysed and interpreted the findings, WHO staff in 7 countries who really helped to support this implementation, similarly the UNICEF staff in China and New York who coordinated the research in China. And I want to, and also to the Bill and Melinda Gates Foundation for the funding. I want to highlight 2 things, however, that there was, in addition to the teams that were involved in the research, an international scientific advisory group, 5 eminent scientists who really gave advice to the direction and the design of the study, and that in all countries the research was approved by ethical research committees, including the WHO Ethics Review Committee. The study sought to answer and address 2 questions. What are women's experiences and attitudes towards marketing? And secondly, what are the experiences and attitudes of health professionals towards formula milk marketing? What the study did not try to do was to aim to prove that marketing works. And the reason for that is simple. We know it works. There is, in fact, a strong body of public health literature that has examined tobacco, alcohol, marketing of sweetened drinks, and that is clear that it does actually work. But we don't even have to go to the public health literature. We know that for all products, cars, shoes, coffee, whatever, and even examples of really health promotion, car safety belts, physical activity, that marketing works. And marketing, there's about a 3 to 5 billion investment in marketing of formula milk each year. That wouldn't happen if marketing wasn't influential. The study design started with the question, what data would be needed for a commercial marketing campaign? And so instead of trying to collect data that were representative of a country about feeding practices, we went to the settings where trends in values and beliefs are set, and that is generally urban settings. So that is where it is restricted to. We aim to capture what in industry and within marketing is referred to as the customer journey. We called it, let's hear the voices of women. Multiple methods were used: desk reviews, phone diaries, focus group discussions, in-depth interviews, survey tools. And those data were collected and synthesized, and they were then analyzed using a marketing framework. For all of this, we engaged the experience and expertise of a company that has communication and behavior change at their heart. And these exact areas of experience are those exact same areas that are used in commercial marketing. And so it's important to say that the findings we'll share now are not representative of a country, but they're representative of the populations where trends and values are set. These are the 8 countries where the research was conducted, and you can see them for yourself. They are a mix, but there's a country in every of the regions of the world. And they represent both high and low middle-income countries, and they reflect a range of breastfeeding practices as well. But they were all conducted in cities. The findings that I'm going to share now are the findings as reported by MNC Saatchi World Services, the group with the behaviour and communication change expertise. And they're categorised in 4 ways: exposure and channels, messages, health professionals, and women's voices. So first of all, just to say that there were over 8,500 women interviewed and who participated in the survey. There were over 90 women's groups discussions. Over 140 phone diaries were collected. More than 300 interviews were conducted with health professionals, 22 focus groups with various influencers, and we even had 10 in-depth interviews with marketing executives and 2 group discussions with yesaos. These are kind of nannies who support families in the postnatal period. So some of the main findings now. The most dominant feature was just how pervasive and invasive marketing is. Of the 8,500 women that were interviewed, more than 50% reported seeing or hearing marketing messaging in the preceding year. And this is a minimum level of exposure, because what women reported seeing or recalling seeing and hearing doesn't capture all the other ways in which marketing is going on around about us. Self-reported exposure was highest among women in urban China, Vietnam, and United Kingdom. We also just saw how highly personalized marketing was, and this happened through a multiplicity of channels and approaches: social media platforms, digital influencers, talks and events, direct interaction between company reps and mothers through television. Free samples were being given in between 3 and 46% of women in different countries. Promotions and gifts, baby clubs, 24/7 helplines, and also through health professionals. What we saw everywhere was just how dominant was the theme of using science, imagery, language, pseudoscientific claims, and all of these were to build brand confidence and belief. Products were being positioned as close to, equivalent, and even sometimes superior to breast milk, and that scientific evidence was commonly used to infer improved health outcomes. And that's despite the body of public health literature. What we saw clearly was that there are many, many new products that are focusing on allergies and sensitivities, and industry records detail how companies see this as important new areas for sales and business growth. Strangely, we see just how aspirational appeals are used throughout. In some parts of the world, westernized settings using language such as Dutch quality or Swiss purity, or even they showing the green fields of Ireland where I'm from to say this is where the milk is coming from. Ads commonly focus on how products would aid brain development or growth, and in some settings male participation was being shown in bringing up families, conveying how formula was part of a modern lifestyle and inferring therefore that breastfeeding is somehow outdated. What was really very troubling was just the extent by which marketing exploits vulnerabilities and emotions. It positions itself as being friendly, non-judgmental, that we are here to support you and that our products are part of the solution. I will consider the benefits my baby will get or my real need. If I want to promote height, brain development, or digestive system, I will find the respective formula. I know it sounds bad, but my mummy instinct took over and I wanted the most expensive because I'm making up for not breastfeeding her. Again, the comfort milk. I thought that was a good idea. You only want what is best for your child. It was then the trusted role of health professionals that became very evident in the findings. In all countries, it's clear that health professionals are the main source of education and confidence on infant feeding practices. Yet health professionals in all countries, but especially Morocco, Nigeria, and Vietnam, reported how contact with formula milk companies was just extremely common. Incentives were being offered, commission from sales, ambassadorial roles, funding for research, merchandise, gifts, and paid promotional trips were not uncommon. And we see this then translating into the words coming from the health professionals to the mothers. This slide captures the proportion of postpartum mothers who received recommendations from health professionals to use a formula product. In Bangladesh, 57% of the postpartum women reported getting these recommendations, 40% in Mexico, 22% even in South Africa. So what does the study tell us about formula milk marketing? It wouldn't be surprising for WHO or UNICEF to make its own comment, but these are the words of MNC Saatchi World Services. These are experts in behaviour change and communication, the types of skills and practices that are required in marketing. Their conclusions were these. Marketing for formula milk is highly advanced and targeted. Insidious marketing of formula milk is widespread. It exploits maternal anxieties and aspirations. Formula milk companies target health professionals, and marketing serves to undermine confidence in and perceived value of breastfeeding, and thereby it undermines continued breastfeeding. So what's different about this study? There have been many reports about violations of the code of marketing in years gone by, but this is the first systematic and global study of this kind. It was designed, implemented, and data interpreted by people who have the expertise in communications behaviour change. Most significantly, women's voices were captured. More than 8,500 were surveyed. That's over 1,000 in every country. And what were our conclusions from WHO and UNICEF? The first is that marketing of formula products is present everywhere. And this is despite manufacturers saying that they are trying to align with the code. We see differentiated marketing strategies, conventional advertising, health professionals, social media being used. And this probably reflects the growth opportunities seen by industry and the regulatory frameworks within country. It clearly showed just how marketing positions itself as a product to solve life's problems. We understand you, we're on your side. Science is widely used to build confidence in formula products, despite the claims being inconsistent with the full evidence base. We see how digital platforms are now extensively used, and they're able to target and build relationship according to individual profiles. Inference, suggestion are often used to exploit hopes and fears. And we see now, after decades of marketing, just how societal norms and beliefs, even amongst health professionals, have shifted from toward an acceptance that formula products are simply inevitable or necessary for all. And finally, amongst health professionals, there seems to be a cognitive dissonance because they all say breastfeeding is best, but then there are widespread recommendations to give formula milk products. We all face marketing each and every day, and so maybe it is not surprising that we should have marketing around these products. But there is something that's different. First of all, formula milk marketing does have a direct impact on survival, health and development, both of children and women. Secondly, it does disrupt access to impartial, truthful information and support that is so necessary for parents to make decisions. And this is an essential human right. As Anu mentioned, it's characterized within the Convention on the Rights of the Child. Thirdly, it disregards the International Code of Marketing, and this represents the collective will of the World Health Assembly. Lastly, at a time when we are so vulnerable, when we have so many aspirations and hopes, the birth of our children and their early years, a time that is so emblematic of human society, we see this moment being used as for commercial opportunity and gain. Back to Anna, maybe just for some final comments.
Thank you, Nigel. As we wrap up here, let me reiterate a couple of quick points. First, women have the right to make decisions that are best for themselves and their families. But we've also heard from Nigel that women are often the primary target for formula milk marketing and have been for decades. As this research and many other research has shown, many women express a strong desire to breastfeed, but then they encounter a lack of support and relentless marketing. It is our role to ensure that women and families have access to unbiased and the very best information and evidence so that they can make decisions that are right for them, no matter whatever feeding decisions they end up making. Second, we have heard, again, how important health workers are in supporting families, especially those with young children, and often are the trusted source of information. And yet, as we've seen in this report, the extent to which they are systematically targeted by industry. And third, we know that some governments have been active in adopting laws and policies to restrict marketing without limiting access to products. And we will hear about some of these successes later on. Unfortunately, they remain a very small minority. In fact, only 25 countries have laws that are substantially aligned to the code, leaving most others with loopholes that industry will gladly exploit. So, based on this new research, I don't know if you can move it, there are immediate and tangible actions that we believe can be taken. The report actually mentions 6, but let me start with the first 3 here. First, we are calling for scaled-up investments in wide-ranging measures that can support mothers and families. This includes adequate paid maternity and paternal leave and high-quality breastfeeding support, which includes access to a trained health workforce. Second, we need actions to protect the integrity of science and medicine. Health workers, as we've said before, are key allies, but they're also targets of marketing. But through their own associations, they can adopt and implement strong conflict of interest policies. This also means that we can crack down on the misuse of science and stop the spread of unsubstantiated claims. And third, perhaps the most importantly, we are calling on all countries to legislate, regulate, and enforce. Where there are no laws, new laws can be adopted. Where laws exist, they can be regulated and with greater enforcement. I think it's important that governments have a key role in holding formula milk companies accountable for their practices. And in all of this, let's remember that society is not a bystander. Each of us can play a role in our personal and professional capacity in encountering this exploitative marketing. Today, one way that you can show your support is to sign on to the WHO and UNICEF's open letter that calls on industry, governments, investors, and health professionals to take actions. You will be able to find the link to the open letter beneath the live stream on your screen. As I end here, our message is simple. We say that it's time to prioritize maternal and child health rights over corporate interests. Please join us and add your voice to end exploitative marketing.
Thank you, Nigel and Anu, for those striking findings. That video, which really brings home how formula milk marketing is systematically targeting mothers and parents at such a tender time. I think public understanding that this marketing is deeply exploitative still needs to break through into wider public awareness. This video can help. It is made for social media and available on WHO and UNICEF websites, so I encourage you to share it through your channels. Now, after all of that, I'm really keen to hear the perspectives of others. So I am honoured to introduce our panel today. I will briefly introduce them all, and then we will get straight into the conversation. First, we have the Right Honourable Helen Clark, the first elected female Prime Minister of New Zealand back in 1999, a position she held for nearly a decade. Helen also led the United Nations Development Programme from 2009 to 2017. Helen, it's late for you, so thank you so much for staying up to be with us. Joining Helen, we have Rabone Insie, is a registered dietitian and the Director of Nutrition at the South African National Department of Health. She has worked in government, academia and private sector and has more than 20 years of experience working in the field of nutrition. Duong Vu is the Vietnam Country Manager for Alive and Thrive, an organisation that works on maternal, infant and young child nutrition. She also chairs the Scaling Up Nutrition Civil Society Alliance of 14 NGOs in Vietnam. She is joining us from Hanoi. Duong, welcome. And Katie Gilbert is a Managing Director at MNC Saatchi World Services. She is a Communications and Behaviour Change Specialist with previous experience in commercial marketing. The agency's work focuses on behavioural change for social and health issues, and she joins us from London in the UK. And finally, Professor Caroline Homer was a midwife for over 30 years. She is currently the Co-Programme Director for Maternal, Child and Adolescent Health at the Burnet Institute in Melbourne, Australia, and the Chair of WHO's Strategic and Technical Advisory Group of Experts for Maternal, Newborn, Child, Adolescent Health and Nutrition. Caroline, you're very welcome. There is so much to talk about, so let's begin. Helen, I might come to you first. This report, I think, really drives home that we are failing to protect women, children and their families and health providers from exploitative marketing. Do you think we could make more progress by considering this as a human rights issue rather than framing it exclusively as a health issue?
Well, thanks for the question. And of course, there's also the right to health. And I think what this exploitative marketing is denying people is the right to health. In order to exercise your right to health, you need many things to be right. And that means addressing the commercial determinants of health. And here we've just had devastating evidence of these commercial determinants, which are purveying bad health to women and to, of course, to babies, with lifelong impact on their health and well-being. When we were listening to the presentation, so many things flashed through my mind, almost like the similarities with what the tobacco industry used to get away with the marketing of, for example, Virginia Slim's cigarettes to young women on a tennis court. You know, you can look slim and glamorous because you're smoking. And as Nigel's clearly outlined, the research points to how this insidious marketing really tries to appeal to the aspirational woman who, you know, wants her children, wants a career, you know, issues of time and pressures. And when they're told totally inaccurate things about this, quote, choice to use this, it's just plain wrong. And in marketing works, I think that's a key message of what Nigel has said. And it does, to me, call into question whether it's time for the code to be completely overhauled. A quick glance at the code suggests that when it was written 4 decades ago, this was, you know, 3.5 decades at least before major social media penetration of our lives. And so it has rules about, you know, where you can market and where you can't. Those rules don't fit the digital age. You know, we heard the women in the study saying, you know, they got at me on my Facebook page. The code, you know, just isn't up to date with the digital age, and that's one of the points I would take from it. Look, I think that this issue needs to be brought to top of mind again, which this, you know, amazing report commissioned by WHO and UNICEF has done. People may be thinking, oh, the issue's over and done with. No, it isn't. It's still there, and marketing will always find a way to get around regulation. We've seen this with other harmful substances. So I think if we frame it as being about the right to health, the right to have fair and accurate and genuinely scientific information, maybe we can get somewhere. But I would emphasise, I think the code needs to be brought up to date with the new media for advertising, which is so pervasive and can be very, very harmful. Back to you, Catriona.
Thank you. Raboni, I might come to you next. South Africa has been a leader in adopting strong legislation in line with the codes, which, as Helen said, probably needs to be strengthened and upgraded to take into consideration the digital age. But we see that marketing continues to be a powerful force regardless of what legislation is in place. So what opportunities do you see to strengthen regulations and enforcement with regards to formula milk marketing? What more can be done?
Thank you very much, and good evening, good day, good morning to everyone, and thanks for this opportunity to talk a little bit about our code or the regulations in South Africa. Indeed, South Africa, we adopted the code in 2011 and we put it into national regulation in 2012. And we managed to do that through the political will and the support we got from our principal. In actual fact, our meeting that led to the regulations or making regulations come into effect in the country was led by our Minister of Health in 2011, and that showed a lot of political will, and we were able to get through that with that support. But we also had the support of the health professionals, the civil society, which were very supportive and very vigilant in reporting the violations after the regulations has come into effect. And I must tell you, even companies report each other, but we always know when they report, we don't take our eyes from them. We put the eyes on both companies. We also really manage through the support from our collaborators, partners like UNICEF, WHO, IFANA, and the others. And what assisted also a lot was the training of all stakeholders, especially even the environmental health practitioners that are in the port of entry, where they make sure that when an infant formula comes into the country, it actually complies to our regulation, if not is turned back. Indeed, we really want to thank WHO and UNICEF for commissioning this important report on marketing. We have identified the gaps, even ourselves in the country. Hence, we are actually currently working on rewriting the regulations. We published the amendment in 2015, but our legal said we rather rewrite, because we have, after we published the regulations for public comments, the amendments, we got to find other gaps, especially with relating to social marketing, digital marketing, where we wanted to include that, but because they were not part of the published for comments, then they advised that we rewrite. So we are currently rewriting the regulations, and we will be publish them once more for public comments. And in those are the opportunities that we have found, that we have gaps. And this is an opportunity for us to close those gaps. And this report came at the right time to really confirm those gaps that were found. It's around, as I've mentioned, the digital marketing that has been spoken to before, but also the cross-promotion, where we find that companies are now developing other range of similar products to circumvent the regulation. As said, they will always find a way of really marketing. So we have found those are the two main issues that actually led to us rewriting the regulation, and those are the opportunities. And this report actually emphasizes that and actually give us more evidence to say, yes, we are in the right track, and those are the opportunities and those are the gaps that we need to close.
Thank you, Ebony. It's great to hear that it's an ongoing process. Well, unfortunate that you can't just write a piece of legislation and that's it. It has to be constantly upgraded. Duong, I might come to you next, because Vietnam was one of the 8 countries profiled in this research. And even though the code is substantially aligned or moderately aligned in legislation in Vietnam, it's one where women's exposure to marketing is still very high. From your perspective, what are the biggest challenges in Vietnam in terms of aggressive marketing? Are things going in the right direction?
Thank you, Katharina, for your question. So actually, I want to give you some background about Vietnam. As you know, that Vietnam is not yet a mature market. It is highly competitive with many local and global brands fighting for the market shares and new customers. And therefore, the marketing and advertisements are even more rampant, because they compete with each other in order to get the new customers. And Vietnam was among the countries that moderately aligning the code since 2014, so 8 years since the code was enacted. But we still see from the report that 92% of the mothers report that they saw that they were exposed to the formula milk marketing. 86% of them saw it on the traditional TV, while we know that in Vietnam, in order for an ad to be aired on TV, it has to go through a lot of screening. And since the code was adopted, no formula milk ads for children more than 2 years old can be on the TV. So why so? Why the women are still feeling that they are exposed to that rampant marketing? We'd like to share with you some of the challenges. The first one is that, as many of you already highlighted, that the companies are finding ways to evade the law, and especially the national law in Vietnam. They're using the cross-promotion tricks. So I am a mother of 10 and 6, and I still remember that when I saw the TV ads, and the the advertisements are the formula milk for the children over 2 years old, but they are packaged so similarly that you can't differentiate with them, even with the infant formula milk. And when the pregnant women go to the hospitals, they can still receive the free sample of the milk that is a maternal milk for pregnant women. So, and this milk is also packaged so similarly. So it gradually developed the brand awareness, loyalty, and familiarity. So national laws and regulations do not yet cover such cross-promotion tricks. That is the first challenge. The second challenge is that Ribon also just shared the case in South Africa, and it is also true in Vietnam, where we are one of the top 15 countries in terms of smartphone users. So any mother will share the experience that they receive the advertisements every hour from Facebook, YouTube, Google Ads, from any newspaper that they read online. But in Vietnam, the Ministry of Health only has 3 health violator inspectors overseeing the code. So how can we balance, how can those limited human resources can oversee the thousands of violations, especially on the digital platforms? So that is where we will need the support of the ethical technology that can help the health inspectors with the tools so that they can identify and also stop that practice. And I think the last challenge also in Vietnam and perhaps other countries, given we are living in the pandemic, COVID-19, and I see that the companies are also maximizing the pandemic in order to approach the mothers. They make the misleading or unsupported the scientific claims, and they preying on the parents' fears and disseminate it through the scientific conference with the health staff. So the Scaling Up Nutrition Civil Society Alliance of Vietnam, we reported violations of 10 formula milk companies when they donate the milk to the hospitals, and they also promote on formula milk and enhance the immunity against the COVID-19 widely on the media. So those are somehow the big challenges that are in Vietnam. But I believe that now in Vietnam, with the growth of the online breastfeeding mothers community, and we still see hope, and we have to thank the growing number of the health professionals who are breastfeeding supporters. Thank those mothers, breastfeeding mothers communities, what include those whose first baby maybe was fed with formula, but with the second one, she could breastfeed her baby exclusively, and those are the ones who really change her mind and can also spread the words to the others. And also the civil society at WHO, UNICEF, and all of us, we can broaden the alliance and to protect the children. Yeah, so over to you, Katharina.
And I think there has been a big improvement in the exclusive breastfeeding rate in Vietnam in the last 10 years as well. So that's something positive to take. Caroline, I'm going to come to you now. I think it's very clear that the report exposes how industry explicitly targets health workers. Do you think health professionals recognise the scale of and the pervasive nature of marketing, and that they themselves are targets?
Thank you, Catriona, and hello everybody. Greetings from Australia. This is such a terrific report. I think we really have so much in these few pages that we can work on. I think we do recognise that milk marketing is a problem. Health providers, midwives, obstetricians, paediatricians, we've been working really hard to try and meet the code. I have to say that sometimes that's not easy because of the cleverness of the large companies and the way these things are sometimes hidden. So it is a problem that we recognise, but I think this report shows us the magnitude of the problem. And particularly around the marketing, the pervasiveness of the marketing, I think we're all a bit immune to social media now. It just happens all the time. And as Helen said, the code hasn't kept up with the last 20 years of Facebook, Instagram, TikTok, whatever the latest thing is. I was really shocked to see a lot of the data in this report, the free formula samples, and Duong has just mentioned that in Vietnam, the blatant advertising in hospitals and the community, the television advertising, the other media platforms. I was really shocked that more than a quarter of women in Vietnam had received free formula samples, about a fifth of women in Morocco, in China, in the UK. These are huge numbers of women being peddled this marketing. And as I said, it is difficult to kind of unravel some of this as a health provider and as someone who works alongside health associations, professional associations. We really need a global register of companies to help us all uncover the links, which sometimes are very hard to find. Just a couple more things, Catriona. One is I really found the data on the preying of women's confidence and anxieties, especially in early pregnancy through digital platforms and targeted messaging, really concerning. And we heard it in the video as well. Women, almost by the time they've told someone they're pregnant, things are flying into their Facebook page because the marketers are very clever. This marketing reaches women before they've seen the midwife for their first time, before they've seen their obstetrician, well before they've met their first paediatrician or child and family health nurse. So it's hugely influential. And the other area, which is this marketing of mother's formula, which I have to say I hadn't heard of before, but this is mentioned in the report as something for women to have through pregnancy. And again, it's preying on women's uncertainties, their fears, their desire to do everything right to have a healthy, happy baby. And so by marketing mother's formula, sends a message that women need help. They need more supplements, that they're not capable of doing this with the people around them. And so that marketing of and dispelling the confidence of women affects health professionals. So the distorting of science then further undermines the capacity of the health professional to even address the incorrect information. And as a midwife, when you're caring for a woman, you don't want to kind of damage your trust with her by telling her that what she's saying isn't true, is nonsense, is incorrect. It kind of messes up your relationship. And so you try and unravel that science to tell the truth, but it's really hard. So I think health professionals have a lot of work to do. We really welcome this report. We welcome the commitment of UNICEF and WHO. We welcome the actions that we can talk again about in a moment. But, you know, this is the moment now, I think, that we really have to make change happen to really address the marketing of formula milk to mothers and babies and to health professionals. Thank you.
Thanks, Caroline. And I think the thing is, health professionals have a lot to do already. You know, they're busy, they're in the middle of a pandemic, they're working in under-resourced health systems, they don't have enough time or money. So giving a job of trying to resist this marketing effort is just another thing to add to the to-do list, which seems kind of unfair to me. But we'll come back to that. Katie Gilbert, I'm going to come to you now. You have a background in commercial communications and behaviour change, and you apply your knowledge to bring about behaviour change on social and health-related issues. What do you take from the report's findings?
I think the first thing to say, there's probably two things that influence how I look at the findings. And the first thing to say is aligned with what UNICEF and WHO said at the beginning. Formula milk as a product absolutely has a place for women or caregivers that cannot or choose not to breastfeed. And I think the other thing to say is that I wouldn't be doing the job I did unless I believed in the power of responsible marketing to empower informed choice. And I think that's really important. So therefore, the focus for me looking at the findings is, where does it look like communications is doing the opposite? Where does it look like communications is actually undermining informed choice? And as a sort of former marketeer, there was 3 areas that struck me. And I think the first is the transparency of who is talking to you. So whether it was the social media platforms, when it was, WeChats or groups that were sort of for mothers, or whether it's sponsorship, sometimes it was clear from the report that there are times when either women are being communicated to directly by a formula milk company or indirectly via, say, funding for a mum's blog, but that's not declared. So that definitely, that idea of transparency of who's talking to you and what's their vested interest, the lack of transparency there, I think, is definitely an issue for informed choice. The second thing I think has been covered well by Caroline already, which is, we expect to get marketing messages across our day, but it feels like some spaces we should be protected from that. And health settings definitely feels like one of them. And whether it was sort of promotional hubs that we saw in some countries, or sort of incentives that have been raised for healthcare providers, anything that impairs impartiality in the healthcare setting is also a real concern. And then I think the third thing that was worrying looking at the report was the correlation between exposure to formula milk advertising and misperceptions. So there was two misperceptions I think I noticed in the report that correlated. One was the idea that nutrition in formula milk is more comprehensive and balanced. And then the other misperception was that sort of after 6 months, breast milk is not enough, and therefore what that makes people think about follow-up milk. Because, of course, it's true, after 6 months, we want to incorporate soft foods into child's diets, etc. But that doesn't mean that you need formula milk as a follow-up. And I think that you can see when you look at the messaging in the report from some of the companies, why those misperceptions correlate to exposure to that marketing. So I think the idea of misleading messaging is a third really important area. So, as I said, I firmly believe in the power of responsible marketing to support informed choice, but there's definitely areas in this report that need to be looked at. And I think the idea of looking at the code in light of these things is really important, because I agree that the code hasn't kept up to pace with all the ways in which there is echoes of irresponsible marketing happening.
Thanks, AJ. And I suppose the thing is, the code hasn't kept up, but neither has legislation at a national level hasn't kept up the code at all. So we're really on the back foot when it comes to tackling these problems. And what you're saying there is that there's this constant planting of seeds that undermine confidence, whether it's in the maternal milks, which undermine your ability to have a pregnancy. Before it was just undermining your ability to breastfeed after your pregnancy, but now companies seem to be trying to get people earlier. And so obviously the marketing works. But Katie, from your point of view, what can we take from the successes of formula milk marketing that public health communication could adopt to improve how we communicate and support mothers and families?
I think there's a few things. So I think the first is empathy. So one of the things I guess, I learned working in commercial companies in my background was a user-centric approach. So making sure you understand the lived realities of people and then reflecting that back in communications. And we're doing a project for UNICEF at the moment in an African country that involved us looking at a review of existing POMs. And what we found is there were so many conversations from the breastfeeding community about what to do. So this is how you breastfeed. This is what foods to feed people to complement a breastfeeding at these ages. But we couldn't find any communications that empathise with what it's like to be a mum, the highs and lows, the hard days. And formula milk companies do that a lot. There's lots of communications that show, we understand you, mum. We understand the highs and lows of parenthood. But yeah, when I look at a lot of communications in the development sector, they're much more focused on, where we have right on our side. We know the right behaviours, so we're going to tell you the right behaviours. But I don't necessarily always see that empathy coming through. And I think I'll give an example from members of SACHI working on childhood obesity, because it was another highly emotionally charged issue where parents sometimes felt they were being blamed. So when we created our Change for Life platform, the first ads we did was, it's not your fault, parents, it's modern life that's changed. There's gaming, there's fast foods, there's things that make it more difficult to be a mum, and it's our job to help you. But it was about making sure that parents didn't feel blamed, and it was modern life that was the issue. And I think empathy is definitely something that we need to consider. The second one, I think, is framing the end benefits. And again, I think one of the things that you learn in commercial advertising is to understand and connect what people really care about. So, for example, if you're working in a community where height is a sign of progress and a child's development, you might choose to have a giraffe that talks and tells you how great this is to do. And I think we're seeing sort of formula milk companies do that because they recognise we're dealing with people who often have busy lives and need shortcuts to work out what's best for their children because they don't have loads of time to engage. But sometimes we feel when we're working with health professionals, they want people to do the behaviour for the reasons they want them to do it. And they're not necessarily open to going, actually, if actually the message on height is the one that's resonating best, and that's going to be the one that really helps us communicate benefits, we'll have a look at that. So I find that sort of sometimes rigidity to want to do the behaviour for your reasons is an issue. And I'll give it a good example from bed nets. There was some research done in a country in Africa on messaging on bed nets, and the health community want you to buy bed nets to stop malaria. But in message research, the best performing message was get a good night's sleep. Because actually the aggravation of having things buzzing around and having to get up and try and kill them, etc., was more of an aggravation than potential death from malaria. So again, I think we need that openness to how we frame things. And then the last thing I'd say is it was evident in the report that a lot of the formula milk companies are sort of setting up, support services from helplines to baby clubs. And I think it makes a lot of people feel uncomfortable because if we're looking at informed choice, should brands with vested interest really being focused on providing those advisory services? But the thing I think as a breast health community we need to look at is what's the alternative that we're offering? So if you're a mum and it's 3 a.m. and you're emotionally exhausted, if you're not calling the helpline that's from a brand, what are we offering in its place? So I think looking at what's the support structure we need to give women to feel supported as a health community to improve informed choice is another part of the conversation. We can't just focus on what we don't want to happen. We need to focus on what we also think needs to happen to improve informed choice for caregivers.
Thanks for that, Katie. That's very interesting because I think humans in general aren't very good at dealing with the future and intangibles. So as your example with get a good night's sleep is a much more tangible and immediate example than don't get malaria in the future. But I suppose the challenge is that public health specialists deal with evidence. So if the evidence that you're going to be taller in the future isn't there, then you can't compete with that kind of claim.
I think thinking about stunting and that being a sign of undernutrition, what I'm not talking about is making stuff up. What I am talking about is looking at evidence points and then saying within those evidence points, what are the ones that resonate most with people? I think that's very different to suggesting we make up a message that has no foundation evidence. That's something that goes into the bucket of irresponsible marketing.
Yeah, let's get that. That's a big bucket. Let's keep that in mind. Duong, I might come to you next because we know that civil society plays such a central role in advocating for action and putting things into the bucket. Can you give us some examples of how civil society has worked with government and other partners to make meaningful change?
Thank you for the question, and would like to share the experience, 2 examples from Vietnam that I hope can bring you some inspiration and also hope for the future. The first one is that we identified the FHI 360 and the civil society in Vietnam collaborated with a young startup company. After consulting with the Ministry of Communication and Information and the Ministry of Health, and WHO and UNICEF country office, we developed an application that uses artificial intelligence and machine learning that can identify the code violations on the digital platform. We call that application Vivid, Virtual Violations Detector. It is a kind of virtual assistant to the health inspectors. So like on daily basis, the Vivid will automatically crawl the data, images, text from the online platform, and then it will, based on the algorithms and that we already teach Vivid, it can auto-detect the code violations, and we alert the health inspectors of the violations. And after that, the health violations will issue the penalty, and Vivid can again assist the health inspectors to keep track which violations have been issued penalty and which one have been sanctioned. So in 2021 alone, Vivid that scanned 17,000 posts from 40 fan pages of 40 different formula milk brands and retailers in Vietnam. And Vivid found 4,000 violations at the accuracy of 76%. So we feel that, as I just shared from my previous presentation, that with a limited number of health inspectors in Vietnam, the support of Vivid is quite enormous, because can you imagine that 3 health inspectors can't scan 40 pages every day and can't, therefore now with the support of the artificial intelligence and machine learning, we can then now support the health inspectors with the violations. And this initiative is now being replicated more globally to other languages. And we now start first with the English-speaking countries like Australia, Hong Kong, Malaysia, Singapore, Philippines, Nigeria, and then to other languages where we are present like in Bahasa, Indonesia. So that is the initiative we call CATCH, the Code Accountability Tool and Code Hub. So it will have to uphold the companies accountable, and because we can't deny that some naming the companies and their inappropriate practices also help to make them accountable for this area. So the second example is that we collaborate with the Ministry of Health in Vietnam to enforce the code compliance at the health facilities by renovating the baby-friendly hospital initiative, but with the support of technology. So now after the mothers are discharged from the hospital, receiving the support from the midwife, like Carolina just mentioned, then the mothers will be surveyed via phone and to ask them if they observed any code violations. For example, did they receive any advice from the health staff on formula milk? Did they receive any free samples at the hospitals? And then these feedback will be sent to the hospitals in real time and quarterly, so that the hospitals can know which department in the hospitals are where code violations are still existent. And then it will create a feedback loop for the hospitals to improve their performance until they are designated. So the hospital staff used to tell us that before, when they are supervised by the Department of Health or Ministry of Health, they only visit the hospital for one day and they can prepare for it. But now, with the eyes of hundreds of mothers every day observing them, monitor them, they have no way but to improve their service, their real service. So, but later on, the important aspect of this initiative is that when the hospitals, after a lot of effort, they are designated as Center of Excellence for Breastfeeding, we promoted them on the media and by the breastfeeding mothers community themselves. So here you can see that the hospital are appreciated not only by their supervisors, that of the Ministry of Health, but they are also appreciated by the mothers and by the community. So by this, we can broaden the alliance. They make them feel proud that they are doing the right things to the community. So it is, we will bring the breastfeeding is something that the health staff feel proud that they can do the good things to the society and the community. So those are the two small initiatives, and we are doing hard to replicate it. But it shows example that when we have an alliance of civil society, the breastfeeding mothers community, the health professionals, the media, governments, and the technology companies who are committed to the bringing the social impacts, then we can broaden the circle of love of protecting the breastfeeding and bringing change to the society. Yeah, over to you.
Well done, Duong. That's impressive and inspiring to hear that you've created this ecosystem of support and made all the connections from all the different actors that need to drive the change. I'm sure people will be contacting you to find out how they might get Vivid into their health settings, because I'm sure it's a situation that's replicated all over the world where people don't have adequate inspectors to enforce, to monitor or enforce, or for there to be any repercussions from violations. Raboni, I might come to you next, because it's clear in the report that even though health professionals are such a trusted source of information, because they are being targeted by the industry, they are, being open to becoming, actors for marketing, maybe unwittingly. So how can government work with health professionals to protect the integrity of science and the independence of health workers?
Indeed, it is correct that even the communities trust health workers. So they're an important source of information and the public trust them. So I think the companies know that very well. Hence, they are targeting them because they know that mothers will trust what is coming from the health professionals. What I've realized, or what we have realized as a country, is that capacity building is not a once-off thing. It should be ongoing. When we started with the regulation, when we adopted them, when we published the regulations in 2015, 2012, and again publishing for public comment in 2015, we were doing more training, more capacity building, telling people about what the regulations are, what they contain, and so on, recognizing violations, reporting violations, and so on. But as time goes on and more violations emerge, for example, the ones you have mentioned, new ones of digital marketing and so on, and new people come into the field as well. So some who are targeted are those that have never even trained or capacitated in these regulations. So some of them, honestly, they do not even know that they are violating, they are flouting the regulations because they are really not capacitated or they don't have a deep understanding of the regulations. So what we have decided to do, or what we need to do, is to make sure that our training is ongoing. And we have decided we will work very closely with the professional associations. For example, the Association of Medical Association, which includes mainly doctors and dentists, which are even a source of health professionals that we really never come to capacitate a lot. Dentists, most often, they found children with rotten teeth, and mainly because they sleep with a bottle of milk, and they never connect the two. Somebody said to me, the dentist said, you must stop drinking, giving your child sweets, and said, I don't give my children sweets. Then only then, when I told her that, does your child sleep with the bottle, and connect the two, and that's only then that was an improvement. So those are some of the people that we really need to work with, to make sure that they start recognizing and start talking about it and finding the influences, what influenced these mothers to release formula feed, when they start talking about it. And we also, mothers are exposed mainly to nurses. We often concentrate, because by nature breastfeeding is more of nutrition, so we train more or capacitate more nutritionists than dietitians, but we have more nurses than dietitians and nutritionists, and mothers are often seen by nurses. So we also need to work with the nursing councils and nursing professionals associations to make sure that we capacitate nurses. Of course, even dietitians and nutritionists, especially the young ones who are graduating and have not been exposed to. It's different when you do something when you are in as a student to study, to pass, but it's also different when you are now in the field to listen more, because you see the effects thereof. And of course, that we also have to continuously work with our academia, to make sure that the students that are coming from there, they are also capacitated and they come into the field already knowing what to do. And not only nutrition and dietitians, but also environmental health practitioners who are our law enforcers in our country. What struck us, of course, we work with NGOs as well, because we find a lot of violations also reported by NGOs and our civil society and individuals. So that's very important for us to capacitate them, because those are the ones who are right on the ground, on the grassroots, who are connecting with the communities, who are on day-to-day, meeting with the mothers and hearing the struggles of the mothers. One thing that also struck us, that we found a group that we really never thought of and never imagined it could also be the target, of really spreading a misconception around the importance of formula feeding, presenting formula feeding as a solution and as if it's something that is needed. Medical aids. You never thought a medical aid would actually promote formula feeding, because it's counter, what they stand for. It will, if infants are formula fed, they are more likely to get sick and be in hospital, so they exhaust their medical aid. But what was striking, I need to tell you the story. One of our admin officers had a child, but is a male. So the wife gave birth, and the medical aid phoned the wife to say, they hire health professionals, and the health professional called, "Oh, congratulations, you gave birth, and now it's very important to feed your baby very well. There's this milk formula that is so good that you can use," and so on. And this woman, because our admin officer, the husband, knows very well, because he works in the nutrition director and he's very conversant with these issues. And the wife knew that only breast milk is the best, and we don't have a problem. We have sufficient breast milk, and we were just shocked that companies like medical aid companies are actually promoting breastfeeding, have hired people, not breastfeeding, formula feeding, have hired people to really promote infant formulas, and we had to call that medical aid to order. But we then saw that there could be many other groups that we are not aware, that we really need to work with to make sure that everybody is capacitated, everybody doesn't fall into the trap of believing that infant formula is necessary and is needed by all the children, and that you are not, breast milk is not enough or cannot be enough, or, dealing with issues of marketing. So those are some of the things that we are working on, and that we are realizing that really capacity building is not a once-off. It has to be continuous. And even when we build in new things and when new violations come in that were not there before, like we have mentioned about digital marketing, which was not there in 2012 when we started. And unfortunately, digital marketing doesn't have boundaries. It is multiple channels. It cannot be contained by geography. It's everywhere. There are times where we are actually, I'm glad that we are talking about this in this platform, in a global platform, because there are times where our people are getting these things that are actually coming from other countries, and we are not sure. Can we even enforce our regulations upon a company that is not even in our country? And they'll say, no, the administrator is from this country, it has nothing to do with, there's no control, and so on. So those are some of the things that we really need to keep on working on and capacitating our companies around it. But also, just to cut off, there are many other companies that are not necessarily within health and so on, but they are used by other that are not related as sort of a social responsibility issue. So we also need to work with such. Thank you. Let me end there.
Thank you, Ravoni. I think it's clear constant vigilance is required and constant innovation to adjust to the changing environment. well done to your colleague's wife for resisting that phone call. And it just shows, you have to be informed to be able to resist this information, and what an effort that is. And I think of all the women who might receive that phone call who don't have that information and just take it at face value. Caroline, I might come to you next to see what you think can be done to support health professionals to resist the marketing efforts. Is it as simple as more time and more money, please?
Well, both those things would be nice, but that's not that simple. I looked at the opportunities for action in the report and sort of thought about how we, as health providers and particularly midwives and nurses, could work on those. I think recognising the scale and the urgency is critical. We have to, as providers, have the facts at our fingertips, be really clear in our messages and consistent in our messaging with women and families, and very clear of our support of breastfeeding, because we know that messaging and that support really makes a difference. We have to support regulation, legislation and enforcement. None of those things are easy, and in our countries that's going to require a lot of advocacy and a lot of work to make those things happen. I come from Australia. We managed plain paper packaging of cigarettes 10 years ago, so it's possible, but it's a long journey. We have to help each other. I think professional associations and health services must come together in this endeavour. And I think Duan gave us a lovely example of an alliance with civil society and women's groups. We have to harness together. Together we are stronger. I think the last 2 years in the COVID era has really showed us how easy it is to damage the integrity of science. And I think we see that in the breast milk market, formula marketing area as well. And so we need to invest in some good social science research to help understand these issues. Why are we so gullible on something we see on Facebook, but we're not to our provider, to our midwife, to our doctor sitting in front of us who's got the information. I agree with the call to action in the report that we must invest in mothers and families, of course, but I'm going to add to that we have to invest in midwives and nurses. Together we make up the largest proportion of the health workforce. Practically every woman having a baby in the world will go past a midwife, a nurse, a community health worker, and then a doctor as well, depending on where she has a baby. So our groups, midwives and nurses, I'm going to put a special shout out for, absolutely key. Investing in education, leadership, support and models of care to make sure we give the best care to women. And finally, I'm trying to think of sort of ways to mediate the marketing influx. And so I think it's building up women's confidence when they're pregnant, when they have a baby in those first months and years, building up their confidence in themselves, in their resilience to resist marketing, normalising breastfeeding, providing consistent information and support, keeping mothers and babies together after birth with immediate skin-to-skin contact. There's a number of quotes in the report showing how women were separated from their babies and given back once the baby had some formula. So I think they're good practices, good evidence-based practices that we can do now. We need to do all the other work, but there's a whole lot of work we can actually do now to build the resilience in women and families and for us to resist the marketing huge thing that's moving across our world. Thanks.
Thank you, Caroline. I totally agree. Investment in nurses and midwives is so critical because women are at their most vulnerable at that time. And if nurses and midwives have the time to give to that woman, then they set them on the path and, they just get them off to a good breastfeeding journey. And I think we can take the positives we can take from COVID is, yes, there was a prevalence of misinformation, but there was also massive social changes rolled out by government in short periods of time that shows that action can happen very quickly when it needs to. And this is a very important issue where that kind of action could happen. You just write a piece of legislation, resist the lobbying and push it through. And I think that's the kind of action that we need in the world. So I might come to you, Helen, and we're kind of coming to the end of our discussion, but Helen, is this an issue on the radar of heads of states? And if it's not, how do we get it onto their radar? How do we engage leaders at the highest levels to start taking action and prioritising this issue?
Well, I very much doubt that it's on the radar of heads of state and government at the moment. So the issue is, how do you do that? And I think with the very, very wide networks in every country that the WHO and UNICEF have, there needs to be a concerted effort on first disseminating the report. Identify who needs to know about this. Clearly, health ministries need to be briefed. Ideally, health ministers need to be briefed. Parliamentarians who work on health issues or children's rights issues or women's rights issues need to be briefed, because there are arguments for each of them. Clearly, the health workforce, as Caroline said, is absolutely critical. If you've got the midwives on board with you, with the right messaging through the pregnancy, childbirth, and immediate post-birth period, that's a great start. And then often, the work carried through with the nurses who focus on child health. There's the NGOs, the civil society advocating across children's health and women's health and rights. So I think it's firstly establishing that this remains a very real issue, that there is a code, but it's somewhat outdated, and perhaps through this process begin to encourage people to think about whether the implementation of the code, even as it is, let alone what it could be, is strong enough in their country. Now, I did a quick check on how many countries have put something in legislation. 39 have legislated for the code. Another 31 countries have put a number of the provisions of the code in legislation, and 65 have put a few in legislation. That's 135 countries all up. I must say, I find that mine is one country where they've always made it a voluntary and self-regulatory implementation, which frankly won't work very well. And why it's so timid on that when we have no trouble, as Carolyn said, regulating tobacco to a very high degree, and to some extent alcohol as well, I wouldn't know. So I think it's about starting conversations which percolate up into the policy process. And of course, on the margins of important meetings like the annual UN General Assembly, there's surely, opportunities for side meetings, engaging heads of state, getting a panel of them, because getting such an invitation forces heads of government, I know because I've been one, to focus on the issues and say, maybe we should be doing something about that at home. So I think it's really getting some balls rolling now. We've got the tools we need in this report. We've got information. We know the damage caused, and we're now looking for people to come on board with solutions and putting it right. As Caroline said, it's not going to be a quick process. You may get really lucky in some countries where a minister says, I get it. I'm going to get some work done on this, and I'm going to get that law or regulation changed, or I'm going to move from voluntary implementation and industry codes to something more. And that's fantastic. For others, it will take some time, but get the discussion going.
Thank you so much, Helen. I think we could probably talk about this for hours, but I think we're going to have to draw this to a close. And I'd like to thank you for your contributions here today, but also for your steadfast commitment to this issue. And I do hope that this discussion will have a ripple effect, and we will continue these conversations. And for those of you who are watching, please take this conversation and continue it in your own countries, and call and advocate for meaningful change and action. Deeds, not words, as the suffragettes used to say. One small action would be to add your voice to the WHO and UNICEF's online open letter calling for an end to exploitative marketing of formula milk products, as mentioned earlier by Anu. Just below the live feed, you'll see a link to it. So please sign and spread the word. Thanks to all of you watching us live. I urge you to share the report and related materials, and to continue the conversation using the hashtag #EndExploitative We will be having a second launch later to accommodate time zones in the Americas. The next event begins today at 5 p.m. Geneva time, or 11 a.m. Eastern in New York. WHO and UNICEF will present the same findings, but we'll be joined by a different panel of experts. Recordings for both of these events will be available on this site by tomorrow. As I said earlier, today is just the beginning. Throughout the year, there will be a series of forthcoming reports on digital marketing, the political economy, and human rights, to name a few. So make sure to keep an eye on those and to use this evidence to call for change at a national level. Although the international community agreed almost 41 years ago that infant feeding was too important to be subject to normal commercial rules, we still clearly have a long way to go. It can be disheartening to see the scale of what needs to change, but the antidote to despair is action. And civil rights leader Martin Luther King said, "The time is always right to do what is right." So for now, as we say in Ireland, Gurb Mahagut agus Slán. Thank you and goodbye.